it had to be essentially legislated away, because if mixed states occur and if they're common, then the whole distinction between bipolar illness and unipolar depression becomes more problematic. You can't differentiate bipolar and unipolar because you can't differentiate depression and mania, because most people are mixed. And in fact, many clinicians don't know, although those who read the Psychiatry Letter and follow our podcast will know, that the old concept of manic depressive illness meant having depressive or manic episodes. It didn't matter whether it was just depressed or manic. It could be either one. Manic depressive illness essentially meant bipolar illness plus unipolar depression. It meant that there's no distinction to be made at the diagnosis level. Yes, the symptoms may differ, but that doesn't make it a different diagnosis or a different disease. In contrast with DSM-3, the claim was made that these were different diagnoses and different diseases by, as we've discussed, claims about validity, research on genetics and course of illness differentiating the two conditions. At that time, as we now know with 40 years more research, the genetics and course of illness do not differentiate bipolar, unipolar, and essentially supports the old concept of manic depressive illness, that these are represent one illness.